There's a wide range of what's considered normal when it comes to how kids play, speak, and interact. But if a child isn't meeting developmental milestones or has behaviors that make everyday tasks difficult, there may be an underlying condition that's affecting their development. One such condition is Autism Spectrum Disorder, or ASD. In this video, we'll be looking at the different signs and symptoms of autism spectrum disorder in children. So let's get started. Autism spectrum disorder, or ASD, is a complex neurodevelopmental condition that affects how a child interacts with the world around them. It affects how they communicate, how they behave, and how they learn. Because it's a spectrum disorder, the symptoms and severity of the condition can vary widely from person to person. However, most symptoms can be grouped into two broad categories: social communication challenges and repetitive behaviors. Let's first talk about social communication. Children with ASD often have difficulties with social communication and interaction. This can include having trouble making eye contact or avoiding eye contact altogether. They may also struggle to understand facial expressions, the tone of voice, or other nonverbal cues, such as when someone rolls their eyes or throws their hands up in the air. As a result, they might find it hard to understand what others are thinking or feeling, which can make social interactions confusing and potentially overwhelming. Children with ASD may also have difficulty sharing interests with others, taking turns in conversations, or understanding and responding appropriately to social cues. Some children with ASD may prefer to play alone rather than with others, which is understandable given how challenging social interactions can be. As a result, forming and maintaining friendships can be difficult. Conversations with those with ASD may sometimes feel one-sided or repetitive, as some children may struggle to respond appropriately to back-and-forth conversations. Children with ASD may also have delayed speech development or use speech in an unusual way. For example, some may use Echolalia, which is the repetition of words or phrases. Others may speak in a robotic or sing-song manner or have trouble using the correct words to express their needs and wants. All of these symptoms can make it difficult for children with ASD to communicate effectively and build relationships with others. Another key aspect of ASD is repetitive behaviors and restricted interests. Children with ASD often engage in repetitive behaviors such as hand flapping, rocking, or spinning. These behaviors can serve a variety of functions, such as helping the child to stay focused or calm down when they're feeling overwhelmed. Children with ASD may also have a strong need for routine and become upset when there are changes to their schedule or environment. Some children with ASD develop intense interests in specific topics, like numbers, maps, or certain TV shows, and focus on them obsessively. This can be a positive thing as it often indicates a bright and curious mind. However, it can also make it difficult for the child to transition to new activities or learn new information. In addition, children with ASD often have unusual play behavior and may line up their toys rather than use them to engage in imaginative play. They may also be very sensitive to sensory input from their environment, such as bright lights, loud noises, certain textures, or even the smell of certain foods. Some children with ASD find these sensations to be unpleasant and may try to avoid them altogether. Others may react to these sensations by becoming overwhelmed and having a meltdown. Other possible signs of autism in children include difficulty with motor skills, such as riding a bike or tying shoes, unusual emotional responses to events or objects, and trouble understanding personal space and boundaries. Many children with ASD also experience high levels of anxiety, especially in new or unfamiliar situations. Recognizing the signs of ASD early is crucial. If you notice multiple symptoms that are affecting your child's daily life, it's important to consult with your child's pediatrician or developmental specialist. They can conduct an evaluation and determine if your child would benefit from early intervention services. Early intervention can make a significant difference in the life of a child with ASD, helping them develop the skills they need to succeed in school and in life. It's important to note that every child is unique and will experience ASD in their own way. The symptoms and severity of the condition can vary widely, and many children with ASD also have other conditions, such as ADHD or learning disabilities. ASD is not a disease, but a different way of experiencing the world, and with the right support and understanding, children with ASD can thrive and reach their full potential. If this video helped you, please like, share, and subscribe. We'd really appreciate it. And don't forget to hit the notification bell so you never miss out on any of our videos. Thanks for watching.